welcome to the Kent County Board of Commissioners meeting. Today's date is Thursday, September 13th, 2018. The time is 8:30 a.m. We'll begin this morning with roll call.
Thank you. Good morning.
Good morning.
Commissioners Womack. Voorhees.
Present.
Bonk.
Here.
Talon.
Here.
Steck.
Here.
I heard that.
Here.
I heard that. Skaggs.
Here.
Honstein.
Here.
Morgan.
Here.
Belton.
Here.
Mast.
Here.
Korndike.
Present.
Coleman.
Here.
Jones.
Present.
Hennessy.
Here.
Volkowski.
Present.
Freebie.
Here.
Vice Chair Bolter.
Here.
Commissioner Antor.
Here.
Chair Salfeld.
Here.
Mr. Chair, you have 18 members present, 1 absent. You have a quorum.
Thank you, Madam Clerk, and let me just say on behalf of the board, we're pleased to see you here, and our thoughts are with you during, I'm sure, a very difficult period here. So, we will then call on Commissioner Antor to lead us in invocation and the Pledge of Allegiance.
Good morning.
Good morning.
As you know, the anniversary of 9/11 was just this past Tuesday. And I just want to ask that we can silently reflect on that horrible day and ask for peace for the families of the thousands that were killed during the attack on our nation. Many of these families still struggle with the loss and pain 17 years later. Please join me just in a moment of silence, please. Thank you. Yeah, I also wanted to pray for our clerk and her family during this really difficult time. Obviously, her perspective is great because the family's okay. The rest, obviously, we've heard it before, but all that stuff's replaceable. And I know it's a really tough loss, so Lisa, we're really sorry. I also wanted to pray. I hate this, to have to do this again, but my daughter's been really, really sick, and she's 1,000 miles away from me right now down in Jacksonville. And she's got some pretty severe abdominal issues, and my wife flew down last night, so I just hope that you could pray for her. Her name's Molly, and it's really difficult for me to be here and have my wife down there, but I'm taking care of my grandson in the meantime. So let us pray. God of power and might, wisdom and justice, through you authority is rightly administered, laws are enacted, and judgment is decreed. We ask that you assist us with your spirit of counsel and fortitude, all of the leaders assembled here today and throughout this great country. May they always seek the ways of righteousness, justice, and mercy. Grant that we are enabled by your powerful protection to lead our county, state, and nation with honesty and integrity. We also ask for your shield of protection for all those who serve us in the armed forces and the first responders throughout this land. We ask this through Christ our Lord.
Amen.
Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Antor. We will now move to the next agenda item, item 5, which is a special order of business. Today we welcome Doug O'Brien from the U.S. Department of Health and Human Services. He is the regional director, and he's going to talk to us about the opioid epidemic in our area. Good morning, Doug.
Thank you very much, Mr. Chairman and members of the Commission. As you heard, my name is Doug O'Brien, and I'm the Regional Director of the U.S. Department of Health and Human Services here in the Great Lakes region. This is my second tour of duty. I served in this position about 12 years ago, and one of the unique things in coming back into federal service has been traveling throughout the Midwest and talking about this incredible epidemic that is touching every community from coast to coast, that is touching everyone across all demographics, rich, poor, black, white, Latino, rural, and urban. And while the numbers aren't the same in every area, the impact on lives is. I'm sure that there are people I'm talking to right now whose families have experienced the struggle of a loved one who is dealing with a drug addiction. And I wanted to talk just briefly about some of our federal response, and I think it's especially important for me as I travel around to talk to county governments, because one of the things we recognize at the federal level is that in this battle, counties are uniquely situated to be a critical and important part of our success. When you look at it across the country, obviously, counties are different. There are different structures, different makeups. But by and large, counties are the front line on law enforcement through their sheriff's department and their correctional institutions, their coroner's office and medical examiners, and their public health departments, which are really, in my mind, an unsung part of our healthcare infrastructure throughout the country. So Secretary Azar and the President recognize that our work with counties is critically important in order to achieve success in this battle. Now, everybody knows the numbers here in Michigan. Last year, you had over 2,000 people die of opioid overdoses. Here in Kent County, the number was a little bit under 100. And while I will tell you that that number is relatively low in compared to areas with similar populations, that doesn't diminish the pain of the families that experienced those overdoses, and it doesn't diminish the resources that you as elected officials have to put towards battling this crisis. I want to talk a little bit about how we see this response at the federal level. We look at a couple of elements that really are naturally the purview of the federal government, things that are really sort of at a 30,000-foot level, things like research into how we manage pain in our healthcare system, how we look to develop new medications that are going to address pain without the addictive properties of opioids, how we're going to help develop new modes of treatment for addiction through using medication-assisted treatment and other new paradigms that we haven't even imagined yet. So the CDC and the National Institutes of Health are at the forefront of that battle, and they're fighting for everybody every day. At the same time, we recognize that this is not a battle to be won in Washington. This is a battle that is going to be won in police stations, in church basements, in living rooms, and in emergency rooms in every community around the country. And that's why I'm here today. I want to pledge to you, to Kent County, to your constituents, that the federal government and your state government stand as ready, willing, and able partners to work with you. I've been very pleased to work with the State of Michigan's Opioid Task Force. I've spoken with them and worked with them over the last 10 months since I came back on board. And one of the things I'm really encouraged about, and it's something I want to mention just briefly because it's an example of the kind of innovative ideas that we're seeing that are coming from local communities on up. I got a call from somebody in Governor Snyder's office a couple of months ago because she had heard about a new web system, internet system that was developed in the state of Kentucky that allowed people to, in real time, identify available beds for drug treatment. One of the biggest limiting factors we have in getting people the help that they need. So we convened a call with the University of Kentucky and with Kentucky's government and with the Centers for Disease Control, which funded the University of Kentucky's program. And we learned more about this unique web-based system so that anybody in this room, somebody in law enforcement, somebody in healthcare, even a family member, could go on the internet, put in information for a 45-year-old woman who is struggling with heroin addiction, who is on Medicaid, who lives in this zip code. Enter. And it'll tell you where the closest available bed is for that person to seek treatment right now. So those are the kinds of innovations that we're seeing, and we're working with our partners to share that information and help spread those best practices around the country. Another thing that we're strongly, strongly committed to is the continued and expanded use of medication-assisted treatment, and it's something that we're programmatically working with state and local governments on all around the country. And we stand ready at the regional office to work with the Kent County government to examine and look at opportunities to build best practices and build programs, and also to help others learn about the things that you're doing here in your county that are proving successful. And it's one of the most important parts of my job, is to be able to be a conduit for that information and to share those success stories all around the Midwest. One other thing that we're committed to doing, and we've shown great success at, is the use of overdose reversing drugs, typically called Narcan or naloxone. And we are committed to making sure that law enforcement, first responders, healthcare professionals, even individuals and families have universal access to naloxone. Because while we all have to work together to attack the root causes of this epidemic, the first thing we have to do is everything in our power to prevent the 118, 116 deaths that occur every day from opioid overdoses. That's our first priority. And if we can do that together, then we can continue to battle the root causes of this problem. Over the last 3 years, federal funding for opioid response has increased tenfold. And I say that when I talk to government bodies because I'm looking at a bunch of people who know how to budget. Nothing goes up tenfold. They work very hard at budgeting, but nothing goes up tenfold over 3 fiscal years. And it is also a great testament not only to the commitment at the highest levels of government and the President. For the President, this is a personal commitment, very, very personal commitment to him. But it also shows that there is still bipartisanship in Washington. We've had great collaboration from Congress, and they have responded with the resources and the funding that we think is really making a difference. And our focus is to make sure that those resources are available at the community level. So we've had 2 rounds of funding to the state of Michigan to the tune of $16.2 million in 2 phases over the course of the last year. A lot of that money has then subsequently been granted to local governments, counties, municipalities, and other entities who are battling the opioid crisis. We know there's going to be additional funding, and it is part of our commitment to ensure that that funding gets to the states, gets to the counties, and gets to the community level where it's needed. And I will also mention that one of the things we did add in our latest round of funding, we did create a set-aside of direct funding for the opioid crisis for our tribal partners, which is something that we hadn't done in the first round, but we've been working very closely also with our tribal partners, where obviously this crisis is very, very acutely felt. But I know you guys have a lot of business to conduct today. I wanted to come and be able to speak to you. I'll be speaking to the county's opioid task force later today with some of the folks who are really working on the front lines and learn about what they're doing and ways that we can help and collaborate with them. But I wanted to come and speak to the commissioners today and to pledge to you our willingness and our eagerness to work with you to help battle this epidemic here and throughout Michigan. And I'm happy to answer any questions. I'll stay to the end of the meeting if anybody wants to talk further. And certainly our office is always available for any questions and any ideas that any of you have.
Thank you, Doug. I will entertain questions. I know Vice Chair Bolter has a question, so I'll start with you.
Thank you, Mr. Chair. Hi, Doug. Thanks for coming today. Obviously, the opioid epidemic is huge, and it's growing very quickly. There are other substance abuse issues, obviously. What are we doing for prevention, on the prevention side, for just substance abuse in general, or substance use, I should say? Are we doing anything to get into the classroom, to get into middle school? I just feel like there needs to be awareness, and you know, what more can we do on the front end?
Well, every federal agency has been charged by the White House to work on this epidemic in their own, portfolio, if you will. And the Department of Education is doing some fantastic work on getting additional information into the classrooms. I'll point to one thing that I think is a great example, and this came directly from the White House on prevention. I think a lot of you over the last few years have seen an organization called Truth.org that has done some pretty hard-hitting ads about cigarette smoking. and really getting through a lot of the nonsense and cutting right to the chase about the destructive impacts of cigarette smoking. Well, the Office of National Drug Control Policy, which is part of the White House, worked with the Ad Council and Truth.org to produce 4 ads on opioid addiction. And generally, a lot of us are not seeing them because they're not running them on network TV. They're actually working to get them out where young people get their information now. So they're much more prevalent on social media and other online sources. But you may have seen them. There is a limited run on commercial TV on these. And if you haven't seen them, go to truth.org and take a look at these ads. I watched them when they came out. I watched all 4 of them in succession, and it's one of those things where you just sort of sit there for a couple minutes afterwards and try to process, because it really hits home, and it's a message that's particularly directed towards young people about just how dangerous misuse of opioids can be and how immediately they can take control of your lives. So there is a tremendous amount going on. I know that the state education infrastructure here in Michigan is very active on the state's opioid task force and working on getting information to schools as well. But prevention is a huge issue. I will say one thing, as you said, it's a crisis that is spreading. And I want to mention, I don't generally talk about this a lot because we still have to be very focused on the acuity of this crisis, but we're beginning to see some statistical successes. We're seeing geographic pockets, generally areas that were hit earlier, who therefore ramped up their response earlier. We're starting to see data that is very promising. On a national level, we have seen 4 straight years of significant reductions in the number of opioid prescriptions written. And that's a testament to our interaction with our healthcare infrastructure, physicians, hospitals, and other providers who have gotten the message and have changed their practices. So that's a sign of progress. We're also seeing areas where we're seeing a decrease in geographic areas in the number of overdoses and overdose deaths. But we're all working together because this is going in waves through various parts of the country. And that's why we want to make sure we're using the lessons learned from other jurisdictions, and we can help make those available to others who are at an earlier stage in dealing with this crisis.
Commissioner Antor.
Thank you, Chair. Good morning. I was wondering, I know currently here in Kent County, I know of one clinic, Cherry Street Clinic, where we disperse medicines for these individuals to help them with their addiction. We have a new facility on South Division called MedMark. They are there, a similar clinic, but they don't have the ability to help anyone right now because of the Medicaid, Medicare distinction that they need. And I know Cherry Street, if you go there, first thing in the morning, I'm talking like 6 o'clock in the morning, they have a line going out the door because these are people that work every day. You know, you start thinking about this, you're thinking, these are workers, these are people that do just about everything. Doctors, lawyers, builders, factory workers, and we do have an epidemic. And I know MedMark, I went there yesterday and I talked to the individuals. We had a little bit of an open house, and they're struggling a little bit to get whatever they need to open their doors to this type of treatment. And I believe there's a 6-year window, or every 6 years they open the window for new enrollers to come in and be able to service the public here. Is that accurate?
I'm happy to follow up with them and find out exactly what the issue is.
Yeah, I think
Sure.
you can only become a supplier, or not supplier, it's a bad word, but someone that can distribute these drugs, I think, 5 or 6 years.
There are a lot of regulations on medication-assisted treatment. One of the things we're trying to do is to break those down either through waivers with the states or through unilateral action that HHS can take. I'm happy to look into that individual situation, but I will say you touch on something important about medication-assisted treatment, and you point out these are people who are in line in the morning because they're going to work.
Right.
Medication-assisted treatment makes that possible. It makes it possible for people coming out of recovery, coming out of detox, coming out of correctional institutions to be able to stay clean and sober, to be able to go to work every day, and it really makes the battle, it gives us a real leg up in the battle. It has to be accompanied by ongoing addiction supports, recovery supports, therapy, but it's proving to have tremendous, tremendous positive impacts and allows people in recovery to return to a more normal life. And the key thing is having that job, having that responsibility, having something to do takes away the hours of pondering your trap of addiction. So we want to do everything to make sure that those facilities are able to operate. We are still learning a lot about medication-assisted treatment, about the carrying capacity of practitioners, how many people can they effectively treat, because we want to learn, are 3,000 patients too many? Can you not handle that? What's really the sweet spot in terms of the carrying capacity? So that's another thing that we're doing a lot of research on as well.
I do know a lot of these places, their hours, they have to close down at 1 o'clock because all their traffic's in the morning. It's for working people. And you know, I mean, which is kind of goes against what we would think. But anyhow, I would like to get your, maybe talk afterwards so we can,
Absolutely.
kind of bridge that
No,
gap.
very much like, and that's exactly the kind of thing. When you have an issue like that with one of your facilities, please don't hesitate to call our office in Chicago. That's what we're there for, to get you answers. And if we can't necessarily get the right answer, we're going to get you an accurate answer.
I just became aware of this 2 days ago, so yeah, I'd absolutely love to get that information and have you talk with the folks that
Great.
wanting to provide the service. Their hands are tied right now, so thank you.
Commissioner Bukowski.
Thank you, Chair. Thanks for coming in. Yeah, it's, thanks for the hard work on dealing with folks who become addicted and are working through that process. At the same time, even further upstream, is your department part of the conversations, or even more forceful, the conversations with the pharmaceutical industry, who allegedly had a large part in the creation of this current epidemic? And so, some people could look at it and say it's kind of cynical that somebody made a lot of money getting people addicted, and then when you say medically assisted treatment, somebody's going to make money helping these folks. So it's just like, who's making money, and are we really looking at that? So if you look at how many people a doctor can reasonably help through medically assisted treatment, how much have you looked at people who, again, allegedly have thousands of people that they're writing prescriptions for, pharmacies that are just, we're just basically dumping them on the street, for people to pay and pick up the, so all of those, again, allegedly, that what really caused it and continues to cause this addiction, because opioids have been around for a few millennia, so it wasn't like we discovered them a few years ago.
Well, to be fair, the prescription opioids that have really been behind this epidemic are relatively new. When we talk about a class of opioids, you're right, you can go back, opium, morphine, things of that nature have been around for a very long time. But, there's the old saying that, victory has 1,000 fathers, but failure is an orphan. One of the important things in this is that those who have contributed to it, it's important to step up and acknowledge. And physician organizations, I think, have been admirably forthright about the role that prescribing has taken in this. And Secretary Azar has said on many occasions, and I couldn't agree with him more, that the federal government played a role as well. And a lot of these factors are born of the finest possible motivations. A number of years ago, as we sought to create guidelines for healthcare that got patients more engaged in their own care, we sought to encourage more interaction between the practitioner and the patient. And one of the things that a lot of physicians will tell you is we made pain the 5th vital sign. Now, the problem with, you take the blood pressure, you put on the cuff, you use the sphygmomanometer, and you can actually take a reading. I don't know what the reading is. I can't do that. The doctor does. But what physicians and practitioners were doing was that they were asking patients, how bad's your pain? And a lot of you probably remember the smiley faces that they would show you. Which was a little embarrassing to folks like us. We're sitting there pointing to the crying face or the happy face. But what we were doing was we were asking non-clinicians to make a self-diagnosis. And to compound that, we were then tying quality measures to the data feedback on how well a practitioner managed pain. So hospitals and physicians knew that they were going to get quality ratings in part based on the data from patients on how well their pain was managed. And so, when you look back on it, hindsight's 20/20, and you see, boy, that's a recipe for disaster. We're asking people, we're actually encouraging people to prescribe more medications so that people will give the feedback that their pain was well managed. But to the individual layman, how do you know if your pain is well managed? You don't know the acuity of your injury or your condition. You don't know what kind of pain is appropriate. So even the federal government, in trying to create a regulatory construct that got people involved in their care and really reflected the quality of care in how we rate providers, contributed to the crisis. One of the things that I think is critically important, though, we have developed and are continuing to develop with states PDMPs, prescription drug monitoring programs, that utilize technology to identify very, very quickly those pharmacies or practitioners who have spikes in prescribing. We're now leveraging that technology to be able to identify those trends very, very quickly and to be able to take very quick action. If you are an individual physician or practice group or a pharmacy that is an outlier, we are going to see that very, very quickly, and we are going to come down on you, and you're going to have to justify exactly why that is happening.
Okay. Quick timing note, we're coming up on the 9 o'clock hour. I've still got 5 people to go through here, so I'm going to cut the line there, and if anybody still has questions when we're done, I'm sure you're available to answer those one-on-one after the meeting or so.
Absolutely. Thank you again very, very much.
I still go, I'll let a few more go here.
Oh, okay.
Commissioner Mast?
Yes, thank you, Chair. I'm just going to follow up. So is it more appropriate to spend money on prevention rather than treatment? I mean, where's the biggest bang for the buck, do you think? Because there's limited funds. I mean, so when you say there's $16 million that was given to the state of Michigan, where should they spend that? And where should we, as a Network 180, community mental health department?
In different areas, the infrastructure has different strengths and weaknesses. So I don't want to speak specifically to where I think the state should spend those dollars, but I think we have to look at this in twofold. One is, while it is a crisis, it's an opportunity. It's an opportunity for us to learn more about the nature of addiction itself. Learning about the nature of addiction itself allows us to better prevent addiction and before it starts. But we literally have millions of people in this country who are struggling with opioid misuse disorder. And that varies in a spectrum, from relatively benign misuse and inappropriate use to full-blown addiction. Prevention is not going to help them. And we are simply losing too many people on a daily basis to put all of our resources into prevention and turn away from the treatment that these folks need. Treatment is expensive, there's no question about it, but that's one of the reasons that we're working to find new ways to treat addiction and to make additional resources available. I'll add one thing. We have been working with states. Medicaid and Medicare have expanded allowable reimbursement for addiction treatment, just vastly expanded it over what was previously allowed under those two programs. And we're also working with states to expand capacity through waiving certain Medicaid rules for the size of addiction treatment facilities that can be reimbursed. So you raise an outstanding point, and it's something that we deal with on a daily basis. I think that we are equally committed to both prevention in the long run, understanding addiction, because when opioids are tackled, somebody's going to come up with something else. And that's one of the things that's particularly frustrating about this, because we're dealing with synthetic drugs that are being made in a lab. Opioids traditionally were natural products. They're from opium. They're from poppies. Same thing with marijuana, same thing with cocaine. They're plant-based. Now we're seeing laboratory-generated, sophisticated chemical compounds that are coming into this country and our communities. So we're very cognizant that this is going to continue, and we have to use this opportunity to work on prevention and better understanding of addiction.
Okay, thank you.
Commissioner Skaggs.
Thank you, Chair, and thanks for coming in, Mr. O'Brien. looking at a report here from February 2018 from the Federal Agency on Healthcare and Research Quality, talking about the importance of the Affordable Care Act and making sure that there is money available for these kind of services that we're talking about, dealing with hospitalization after overdoses and dealing with various addictive services, and really talking about the importance of Medicaid expansion and the ACA in general and dealing with this crisis. Here in Michigan, obviously, we have our own special version of the ACA with the bipartisan Healthy Michigan Plan, which has, as I understand, helped insure over 30,000 people in Kent County, and it's been a great success here. Just want to urge you that as the federal administration is looking into ways to deal with this crisis, and I appreciate that you've said that you will do, and presumably the federal government will do everything possible to deal with this serious crisis, which has led to, as you say, almost 100 deaths last year in Kent County, to make sure that it is defending the Affordable Care Act, which is the law of the land, to make sure that these resources are available to our citizens.
Thank you.
Commissioner Steck?
Thank you, Chair. Doug, my question is a follow-up on your indication that the funding to address this at the federal level has increased tenfold, I think you indicated. I guess the question is, what's the status of that money getting actually distributed down to the frontline level of care provision? And what's the principal funding service used? Is it through CMS? Is it Medicaid funding streams? Are there multiple streams? What's the status of that?
It is multiple streams, and when I mentioned that tenfold increase, that is just HHS, by the way. And other agencies also have significant funding committed. CMS, obviously, there's significant funding from CMS for treatment under Medicare and Medicaid, and of course that's not appropriated funding, that is mandatory spending. Primarily for the discretionary spending, that $10 billion I was talking about, primarily that's being distributed through SAMHSA, the Substance Abuse and Mental Health Services Administration, and through HRSA, the Health Resources Services Administration. And SAMHSA is overseeing the state opioid response grants, and I believe Michigan has received, either in the last couple of weeks or in the next couple of weeks, will receive another $16 million in funding. And one of the reasons that primarily for those grants they're going to the states is that every state has sort of a different infrastructure, and having the state run point on how to allocate those funds really makes sense because there are different constructs in every state. But we have found that to be very, very effective, and we know that the state health departments and there are different agencies at every state, but there is a tremendous infrastructure and a tremendous collaboration between state health departments and that infrastructure and the local infrastructure. There are also direct grants. There are direct grants through HRSA, generally to community health centers and federally qualified health centers, to provide them resources to up their patient capacity and their treatment capacity, particularly in areas of medication-assisted treatment. So that funding, I am very, very pleased to say, is going out the door. It's going out the door quickly, and it's getting to the front lines very effectively.
So by direct grants, you mean the counties, this county, for example,
Absolutely.
could go directly for those grants?
And we would be more than happy to work with your health department to brief them and give them a rundown on the grant programs that are up and running and available, things that are coming down the pike. We do a number of grant conferences with local governments, and we'd be happy to set one up for Kent County.
Great, thank you.
Thank you. I'm going to draw our line there on questions from our commissioners due to our time, but I'm sure I know there are still some questions out there, so hopefully you'll be available at the end of the meeting and maybe leave contact information where we can individually get in touch with you as well. But thank you for your
Absolutely.
presentation today.
Thank you all very much.
Very good. Then we move to agenda item number 6, which is public comment. This morning, we'll allow public comment pursuant to our rules. We ask that people state their name and address, as has been our practice for the past 3 years. Comments will be limited to 3 minutes per speaker. Speakers will be notified at the 2-minute mark that they have 1 minute to complete their comment and will be told when the 3 minutes has been reached. We ask that speakers line up in the queue and wait for your turn to come forward to address the commissioners. Any person may address the board on matters or issues which are relevant to county government. The chair may disallow comment that is unduly repetitive or not relevant to county government or regarding matters not under consideration by the board. So with that, we'll begin public comment. Please come forward.
Buenos días, mi nombre es Jeff Smith, yo vivo en 987 Milla 3 en Grand Rapids. Soy parte de Movimiento Cosecha Grand Rapids y el GR Respuesta Rápida. Y lo siento a los que hablan español que solo voy a compartir mis comentarios en inglés. So my name is Jeff Smith. I live at 987 3 Mile Road in Grand Rapids. I'm with Movimiento Cosecha GR, also with Rapid Response to ICE, and I apologize to those who speak Spanish that my comments are only going to be in English this morning. So it's been over 2 months since we first asked this body to help us end the contract that ICE has with the Kent County Jail, and to not accept money to hold our immigrant brothers and sisters and family members and neighbors for ICE, when often they've only been brought in because of simple traffic violations. There is nothing regarding ending the contract on the agenda today, even though we asked you that last time we were here. So I'm just going to ask the commissioners now if any of you, in addition to the 2 who have already signed, if you're willing to sign. Because I have only 3 minutes, I'm not going to say all your names. I'm inviting all the rest of you, the 17 who haven't, to do so. Are you willing to do that? To sign this resolution? Please sign. Right here, please. Take a stand.
Sign. It's very easy to do. You sign it? Sign it. Be like Nike, just do it.
So the Kent County Commission has shown that it's not really willing to listen to the people's will. Therefore, we're going to call on our own special commission, what we are referring to as a People's Commission, to model how to listen to the people, how to represent the people, and how to act in a way that responds to their needs. So, for instance, one simple thing, a People's Commission would be holding meetings in the evening, so most of us who have a job could actually attend, not during the day like this one. For our People's Commission, we're going to invite Commissioners Womack and Melton because you have graciously signed, and we appreciate that you signed our resolution. If you're willing to join us and listen to the public and listen to what people have to say about ending this contract. So, with that, I'll just end by saying that I bring you the People's Commission.
Yeah! I now call this meeting of the people.
Is there any other public comment this morning? If there is, please come forward.
About the Kent County Jail contract with ICE. We represent.
Good morning.
My name is Robin Britton, and I'm with 16799 Keller Avenue in
Ma'am,
San Lake.
please move your microphone closer to your mouth.
Is this contract between
One
ICE
six-
and Kent County and the Kent County Jail actually hurting our community?
San-
Yes! Yes, it is. County Commissioner LaDonna, do you
Continue.
have a question?
I would ask the people to honor the rules of the commission and the public comment rules. If you have a comment, please line up in the queue and come forward. Go ahead.
Anyways, I'm sorry, 16799 Keller Avenue, Sand Lake, Michigan, Robin Britton. I am the supervisor of Nelson Township, and I come today to represent a portion of my residents. the farming portion. Just to make it very clear, 95% of my family's income comes from the building industry. 5%.
Excuse me, Chair. I can't hear this. And I think
Well, you want to
we have the right
suspend
to
then?
hear her.
Do we want to do?
I can hear, but I can't understand you. I'm sorry.
Oh, that's okay.
I will ask for a final time that you adhere to the rules of the commission that require public comment. I can see that you will not do that. So we are going to recess this meeting.